Welcome to the Healthcast by Reem Hospital, where we break down complex medical topics into clear, relatable conversations. Today we're talking about something that affects people of all ages: pneumonia.
And what's really concerning is how many people don't realize just how serious it can be.
So let's start with the basics. What is pneumonia?
Pneumonia is an infection that causes the air sacs in one or both lungs to become inflamed and filled with fluid or pus. When that happens, breathing becomes harder and the body struggles to get enough oxygen. It's more than just a bad cough. It's a serious infection deep in the lungs.
Right. And what causes pneumonia?
A lot of people think pneumonia is just one specific illness, but it's actually more like a category of lung infections that can be caused by different things: bacteria, viruses, even fungi in some cases.
Let's break this down for our listeners. What exactly happens in the lungs when someone gets pneumonia?
Well, imagine your lungs are like a bunch of tiny balloons. We call them alveoli. When pneumonia strikes, these little air sacs get inflamed and start filling up with fluid. It's like trying to breathe through a wet sponge.
That's such a vivid way to explain it. And I've heard there are different types based on where you catch it, right?
Oh, yes, there's actually a fascinating classification system. You've got your community acquired pneumonia, which is what most people get just going about their daily lives. Then there's hospital acquired pneumonia, which you can pick up during a hospital stay, and even ventilator associated pneumonia for people on breathing machines.
Speaking of different types, can we talk about bacterial pneumonia for a moment? I've heard it's particularly tricky.
Absolutely right. The most common culprit is this sneaky bacteria called Streptococcus pneumonia. What's wild is that it can actually live in your nose and throat completely harmlessly, but if it makes its way into your lungs, that's when things can get dangerous.
And then there's what people call walking pneumonia, right?
Yes, it's caused by a different bacteria called Mycoplasma pneumonia. The reason it's called walking pneumonia is because the symptoms are usually mild enough that people can still walk around and do their daily activities, though they really shouldn't because they can still spread it to others.
That brings up an important point about recognizing symptoms. What should people be watching for?
Well, the classic signs are pretty distinctive. You've got this persistent cough that often produces greenish or yellow mucus, fever that can spike pretty high, and this sharp chest pain that gets worse when you breathe deeply or cough. But here's something really important. The symptoms can look totally different depending on your age.
How so?
In older adults, you might not even see the typical fever. Instead, they might become confused or disoriented, and in babies, it might just look like they're extra sleepy or having trouble feeding. That's why it's so crucial to know these differences.
I have heard that people mix up pneumonia with other respiratory conditions like bronchitis. Are they similar?
No. And while they might seem similar on the surface, both involve coughing and affect the lungs, they're actually quite different. With bronchitis, the infection is in your bronchial tubes. Think of them like the highways that carry air to your lungs. But with pneumonia, the infection is deep in those tiny air sacs we talked about earlier.
And the treatment approaches are quite different too, aren't they?
Completely different. Bronchitis is usually viral and often clears up on its own with rest and fluids. But bacterial pneumonia, that needs antibiotics and fast. The scary thing is that if you mistake one for the other and delay getting the right treatment, things can get serious really quickly.
What about viral pneumonia and fungal pneumonia?
For viral pneumonia, treatment focuses on managing symptoms and supporting the body while the virus runs its course. And for fungal pneumonia, antifungal medications are prescribed along with supportive care, like rest, hydration, and close monitoring.
So, when should anyone seek medical help?
One should seek immediate medical help when a few signs such as difficulty in breathing, high fever that won't go down, or chest pain show up. If you or someone you love is showing signs of pneumonia or even have prolonged cough that doesn't go away, don't wait. Talk to a pulmonologist or come to urgent care at Reem Hospital.
Thank you for joining us for this episode of the Healthcast by Reem Hospital. If this helped you understand pneumonia a little better, please follow and share. It might help someone else too. Take care of yourselves and each other. We'll see you next time.